When I was younger, I was diagnosed with testicular cancer. And so once I got through that and looked like I was going to survive, I just found myself in medicine, rather circuitously, but I ended up in the field of medicine and then specifically to oncology. If you look over the last 30 years, with the evolution and use of PSA initially, which allowed us to diagnose cancers earlier, but even more recently, we've now benefited from genomic testing where we can actually look at the genes of these tumor cells and the diagnostic capabilities we have with MR guidance and then even more sophisticated biopsy techniques. So 10 years ago, we were able just to diagnose, yes, you have prostate cancer, but we really didn't understand as to what degree the cancer existed. And we really believe now that this is a spectrum disease. Some of the cancers are very non-threatening and others are very potentially lethal. I think that quality of life has really come to the forefront, which it should, similar to breast cancer treatment in the 1990s. Prior to that, most women, regardless of what their diagnosis, underwent a mastectomy. And that had a whole, series of issues that went along with that. And today, I think that we're able to really select patients for appropriate therapy and always keeping in mind that quality of life is paramount. And if you really talk to men, they won't offer it to you, but if you probe them with questions, quality of life is critical. And if you don't maintain it, unfortunately, some of these men can go into a depression, and that can be devastating. So, what starts out as a small problem can snowball into just multifactorial healthcare issues. And so as these men, get older and into their retirement years, quality of life must be considered a huge part of the equation.